Hello, my name is Ben Davies, and this video covers strategies to help with back pain when it's not axial spondyloarthritis. So low back pain is one of the most common conditions that affect human beings, and almost all adults will experience back pain at some point in their lives. Usually, this back pain has something that triggers it, such as too much gardening, and usually this back pain will resolve within 4 to 6 weeks. However, sometimes back pain does persist, and so your GP has referred you to rheumatology to consider inflammatory causes for back pain. The clinical team who you've seen have listened to your pattern of symptoms, examined you and performed appropriate blood tests and imaging when needed. And these tests have all come back to conclude that you do not have a diagnosis of axial spondyloarthritis, a common inflammatory cause for persistent back pain. If your back pain is not axial spondyloarthritis but it continues and it persists, then what should you do about this ongoing problem? Well, the most up-to-date pain research highlights key considerations which I'd like to draw your attention to. Firstly, pain can often be scary and intrusive and distressing, but back pain is rarely a sign of serious pathology. The clinical and imaging examinations you've had would have revealed issues such as joint issues, fractures, cancers, or other structural causes for pain. A challenge with imaging, though, is that anyone over the age of 35 to 40 years of age is likely to have changes in their spine, which will be usually described as degenerative on the scan reports, but are completely normal for your age. These kisses of time are no different to your skin becoming a little bit more wrinkled or your hair going slightly more grey. So using a computer analogy, if you consider that imaging and scans look at the hardware of your spine, you also need to think about whether there are software changes that could be involved in making your nervous system more protective than perhaps it needs to be. Life stress factors such as family and friendships, job and financial insecurity, bereavements, any form of physical or emotional abuse can contribute to making the nervous system more protective of your body than perhaps is required. And similarly, there are close links between emotional and physical health. For example, increasing levels of depression and anxiety are associated with increasing protectiveness of your nervous system and consequently a greater likelihood of pain experience. Crucially, talking about emotional health and social factors doesn't imply that your pain is in any way not real or in your head. Rather, we want to be able to consider all contributors that are leading to your pain being present and persisting. To be most successful in managing persistent pain requires considering the physical aspects of your body, your emotional health, and your social world. Let's start with the physical aspects first. Exercise is crucial for persistent back pain, and you should consider what activity or exercise you enjoy and that you will be motivated to continue with. There's no special magic exercise for back pain. If you enjoy yoga, then do yoga. If you enjoy going to the gym and moving weights, then go to the gym and move weights. If you enjoy walking, then go walking. More important than the type of exercise is your approach to it, and this means neither avoiding exercise, but also not pushing too hard into pain. Rather, try and find a middle ground. Sore but safe might be a good mantra to exercise by. Your clinical team may well have discussed medication approaches with you, and again, there's no magic painkiller for back pain. It's often more effective to use low-strength painkillers such as paracetamol rather than to expect stronger painkillers from either rheumatology or from your GP. Mild opiates such as cocodamol and certainly the stronger opiates such as morphine have got very little role in managing persistent pain. Heat packs and hot water bottles can be very effective to reduce symptoms temporarily. As well as exercise, though, it's worth considering other physical aspects that can help to improve your pain. Pain and poor sleep make each other worse. If you have disrupted sleep, doing an internet search for sleep hygiene strategies will give you many suggestions to improve the quality of your sleep. Smokers tend to experience more pain than non-smokers, and so there is some association with improved pain for those who can reduce or give up smoking. Processed foods that are high in sugar can make pain worse, and if you can, try to keep your diet as homemade as possible. A video like this cannot give you personal advice as to how to manage your emotional health, but do consider what stresses there are in life and whether these stresses can be reduced or perhaps differently managed. Some form of active relaxation can often be very useful in persistent pain. Strategies such as mindfulness, body scans, progressive muscle relaxation, Even simple deep breathing can help to reduce physical tension and emotional distress. Local talking therapy services would be able to guide you more individually. And lastly, social factors for improving pain. As much as possible, we'd encourage you to continue with your usual social activity, family activity, and work employment. Avoidance of these parts of life doesn't really help people in the long run. The advice contained within this video is, of course, very generic and is not tailored to you as an individual. Your local physiotherapy service, based either in your GP practice or a local health centre, they can help you to consider exercise, and they'll be able to support you to return to a level of fitness. Local talking therapy services can help with emotional distress and sleep factors. Your GP practice will also employ a social prescriber, a person who's able to help direct you to social outlets and occupations within your local area. And lastly, Citizens Advice Bureau are a resource to ensure that you're getting access to appropriate employment and housing support if these things are required. Thank you for your time today, and we hope that this video has been helpful.